Every year, over 9 million people around the world are diagnosed with cancer. But what if we told you there's a hidden way to detect cancer early, simply by noticing certain smells? Sounds shocking, right? Most people never think to associate odors with serious diseases, but the truth is, your body can give off subtle clues long before other symptoms show up. Imagine this: a sweet smell on your breath or a strange odor from your feet could be your body's way of warning you about cancer. Yet, these smells often go unnoticed or are brushed off as something harmless. Today, we're diving deep into 6 cancer-related smells that could be hiding in plain sight. These are warning signs that most people ignore, and missing them could be dangerous. Stay tuned as we uncover these hidden health alarms and show you how paying attention to the simplest changes might save your life. Chapter 1: The Silent Scent. When your skin starts to smell different. Skin odor is often dismissed as a result of sweat or food we ate. However, subtle changes in your skin's scent can sometimes signal deeper issues, like cancer. Skin cancer may not always be visible, but the smell could be the first warning sign. This can happen due to the body's natural response to tumors growing. In some cases, tumors release certain chemicals that create a distinct odor. For example, a sweet or fruity smell might be linked to tumors in the lungs or digestive system. According to a study published in the Journal of Clinical Investigation, certain cancers can change the metabolic processes in the body, which results in altered skin odor. A person with melanoma may experience skin changes that cause unusual smells. Melanoma, which is the most dangerous form of skin cancer, often releases compounds like aldehydes, which can be detected through a shift in skin scent. While this is rare, it's important to pay attention to any persistent, unusual odor that might accompany skin irritations or growths. Keeping a close eye on your skin's changes can lead to early detection. Experts suggest using a skin check routine. Monthly self-examinations could help spot growths or skin changes that might indicate a problem. If you notice a new mole or growth with a strange odor, don't ignore it. Book an appointment with your dermatologist for a thorough check. Your skin is your body's largest organ and should be watched carefully for any odd signals. Researchers from the University of California also found that the smell of the skin can change when there's a buildup of toxins in the body. These toxins often stem from cancers, which disrupt the body's natural filtering processes. Your body might also sweat more when it's fighting off a disease, changing the scent and texture of your skin. While it's easy to assume the worst, these skin smells can be signals for something as simple as a bacterial imbalance. But if the smell is persistent, and there are other signs of illness, it's worth investigating further. As unusual as it sounds, your skin could be talking to you. It's important not to underestimate the impact of your body's subtle cues. The sooner you catch an abnormality, the easier it could be to treat. So next time you notice something different, take a moment to assess. Ignoring these signals might just delay the possibility of catching something early. Chapter 2: The Unseen Culprit. Unusual breath odors and their warning signs. Bad breath is one of the most common and least talked about symptoms that could point to serious health problems, including cancer. Many people think it's just from food, poor dental hygiene, or dry mouth. But persistent, unusual breath could be the body's way of signaling something's wrong. For instance, a fruity, sweet breath may be a sign of a rare form of cancer, like pancreatic cancer. The fruity odor happens because the body produces a high level of ketones, a byproduct of fat breakdown, which can happen when cancer affects the pancreas. According to a report from the American Cancer Society, bad breath has long been linked to cancers of the mouth, throat, and lungs. While these cancers are rare, they often show up first in the form of bad breath. The odor is a result of the bacteria in the mouth reacting to tissues affected by cancer. What's more, chronic bad breath can also indicate problems like gum disease or ulcers, both of which need medical attention. One key to early cancer detection is awareness. Dr. Michael K. O'Neill, a researcher on lung cancer at Johns Hopkins University, points out that people with lung cancer sometimes experience a distinctive odor in their breath, often a sour or musty smell. This smell can be a sign that the cancer is affecting the lungs in a way that causes tissue breakdown, which leads to odor-causing compounds in the breath. Studies show that people with chronic bad breath, halitosis, should consider having it evaluated by a doctor if it doesn't go away with typical treatments like better oral hygiene. The key takeaway? Don't brush off bad breath as just an inconvenience. If you notice a change in the way your breath smells, and it's persistent, seek medical help. Breath that has a unique, lingering odor could point to more than just a bad meal or dry mouth. Early diagnosis of cancer through symptoms like bad breath could improve treatment outcomes dramatically. Experts recommend that anyone experiencing unusual breath for longer than 2 weeks get checked by a healthcare provider. Chapter 3, Stomach Talk. Could your digestion be sending you a cancer message? Your digestive system is not only responsible for breaking down food, it can also provide subtle signs of something more serious, like cancer. Unusual smells from your digestive system should not be dismissed. Whether it's a shift in the way your stool smells or an unexplained odor after you eat, your body may be trying to tell you something. One major warning sign is when a sweet or pungent odor comes from your stool or gas. This can indicate pancreatic or colorectal cancer. When cancer affects your digestive organs, it can alter how your body processes food. For example, undigested food can lead to foul-smelling gas. If this smell is different than usual, it could point to a blockage or growth in the intestines. According to a study published in the American Journal of Gastroenterology, people with colorectal cancer often experience noticeable changes in stool odor, and it could be an early indicator. The study suggests that this odor can often go unnoticed by those who don't pay attention to their digestive health. On top of that, people who suffer from pancreatic cancer often experience a change in the smell of their stools. This happens because the pancreas is no longer able to release the necessary enzymes to properly digest food, which results in foul-smelling, oily stools. A condition known as steatorrhea is common in such cases, where the stools appear greasy and emit a strong, foul odor. Doctors recommend that if you notice a sudden and unexplained change in your digestion, take it seriously. While many of these issues can be caused by something benign, like food intolerance, it's essential to rule out more serious conditions like cancer. Pay attention to whether the smell is persistent or if it comes with other symptoms, like weight loss or fatigue. These could be signs that something more than a digestive problem is at play. If you experience these changes, don't wait for the symptoms to go away on their own. Early detection is crucial. The sooner you can get a professional diagnosis, the sooner treatment can begin, which can greatly improve the chances of a full recovery. It might just be the digestive issue you've been putting off, but it might also be a signal that your body needs help. So listen closely to your digestive system, it might be sending you a message. If you found this helpful, make sure to subscribe for more valuable health tips and keep learning how to take care of your body. Chapter 4, Feet Don't Lie, What Your Feet Odor Might Be Hiding. Foot odor is typically brushed off as a minor inconvenience, something we just tolerate after a long day or a workout. But did you know that a persistent change in the smell of your feet could be a red flag for something more serious? Although it's uncommon, feet odors can sometimes signal internal health issues, like liver or pancreas problems, and even cancer. The connection lies in the toxins that our body produces when it's fighting off diseases. In cases of liver cancer, for example, your body's ability to filter out toxins becomes impaired, and it can lead to unusual foot odors. The American Cancer Society reports that liver cancer often causes symptoms that appear after the disease has progressed. One symptom may be changes in the smell of your feet, which could be linked to liver dysfunction. The liver plays a critical role in detoxifying the body, and when it's compromised, it can affect the body's natural odor. If you notice an unusual, persistent smell from your feet, especially accompanied by other symptoms like jaundice, yellowing of the skin or eyes, or unexplained weight loss, it's essential to seek medical attention. Similarly, pancreatic cancer has been known to alter the body's natural odors, including the feet. When the pancreas is affected, the body may develop a stronger, more pungent smell. A study from the National Cancer Institute explains that pancreatic cancer can interfere with digestion and metabolism, which may result in changes in body odor. The body releases certain substances, and these compounds might be noticed in places like the feet. You might be wondering how to differentiate between everyday foot odor and something potentially dangerous. While most foot odor is caused by bacteria, fungus, or poor hygiene, changes that persist despite regular cleaning or have a distinct chemical or pungent smell should be taken seriously. This doesn't mean you should panic, but it's worth having a healthcare professional evaluate the change. Experts agree that unusual or persistent foot odor, especially when paired with other warning signs like fatigue, swelling, or pain, should never be ignored. By paying close attention to changes in your feet odor, you're giving yourself an early warning system. Ignoring the signals your feet are sending you could delay early cancer detection. So, remember that your feet could be giving you more than just a sign to wash them more frequently, they could be helping you catch a serious health problem early. Chapter 5, The Bathroom Mystery, Why You Shouldn't Ignore Changes in Urine or Stool Smells. Bathroom habits are some of the most overlooked parts of our daily health checkups. We tend to ignore changes in urine or stool smells, chalking it up to what we ate or how hydrated we are. However, these smells might be trying to alert you to potential cancer or other serious health conditions. Changes in the smell of your urine or stool can be caused by different types of cancers, including bladder, kidney, and colorectal cancers. One of the first signs of bladder cancer is a strong, foul-smelling urine. Researchers from the Mayo Clinic found that people with bladder cancer often report changes in their urine's color and smell, noting a strong, pungent odor. This happens because the tumor releases certain chemicals that affect how urine smells. If you notice a persistent odor in your urine that doesn't go away after adjusting your diet or hydration habits, this could be a warning sign. Blood in your urine, along with the smell, is another red flag. Likewise, changes in stool odor should not be dismissed. Colorectal cancer often causes noticeable changes in the smell of stools due to the way it affects the digestive process. When a tumor blocks the colon, it can lead to abnormal stool smells. A 2020 study published in the World Journal of Gastroenterology linked abnormal stool odors to colorectal cancer, suggesting that the smell may be the body's way of signaling something is wrong. If your stool starts smelling sour, particularly if it's accompanied by blood or mucus, it's important to schedule a checkup. Kidney cancer, too, can cause changes in urine odor. Kidney cancer can interfere with normal kidney function, leading to the buildup of waste and toxins in the body, which might affect urine smell. A report from the Kidney Cancer Association states that if you notice a foul smell in your urine along with other symptoms like back pain, blood in the urine, or unexplained weight loss, you should see a doctor immediately. Don't ignore your body's signals. Your bathroom habits are one of the best ways to gauge your health. When there's a drastic change in the odor of your urine or stool, it's important to act quickly. Early detection of cancers related to the urinary and digestive systems is crucial. Seeking medical help at the first sign of an unusual change can significantly improve your prognosis and overall treatment outcomes. Chapter 6, From Aroma to Alarm, When Sweet or Fruity Scents Mean More Than You Think. It's not uncommon for your body to give off a sweet or fruity smell after eating certain foods, but when it's persistent and unexplained, it could be a signal that something's wrong. A sweet, fruity odor, particularly on the breath, is often associated with diabetes, but it can also be a sign of more serious health issues, like pancreatic cancer. Pancreatic cancer often alters the way your body processes food, and one of the side effects can be the production of ketones, which give off a sweet smell. According to the American Cancer Society, pancreatic cancer is notoriously difficult to detect early, but one of the signs could be an unusual fruity or sweet smell on the breath. This happens because, as the pancreas becomes compromised, the body switches to burning fat instead of glucose, producing ketones that are released in the breath. If you notice this smell along with other symptoms like stomach pain, unintentional weight loss, or jaundice, it's time to consult with a healthcare provider. Interestingly, another form of cancer that can cause a sweet odor is breast cancer. In certain advanced stages, some women with breast cancer have reported a change in their natural scent, which can take on a sweet or even sour smell. The National Breast Cancer Foundation explains that while this is not a common symptom, it can occur when the cancer spreads to the liver, causing changes in how the body processes waste products. The liver plays a significant role in filtering toxins, and when it's impacted by cancer, it can affect the body's odor. Sweet-smelling urine, too, might be a clue. Some patients with advanced liver disease or cancers affecting the liver have been known to produce sweet-smelling urine. When the liver can no longer filter toxins effectively, they may be released in urine, causing a change in smell. It's essential to pay attention to unusual smells and other symptoms like dark urine or persistent fatigue. Sweet or fruity scents are not always a cause for concern, but if they appear suddenly and don't go away, they could be signaling a deeper health issue. It's crucial to listen to your body and seek help when something feels off. Early detection of cancer can greatly improve the chance of successful treatment. So, if you notice that something as simple as your body's scent has changed, take it seriously. Your body could be trying to tell you something important. If you found this helpful, make sure to subscribe for more valuable health tips and keep learning how to take care of your body.